So hi, I'm Gina Galvez. I just want to introduce myself. I'm a physician associate here at the Akasha Center for Integrative Medicine, and I'm happy to be talking about everything about weight loss today, including GLP-1 agonists. I'm also live here on Instagram, Cell Vitality. So happy to talk to everybody today. Here we are today. Weight loss is a really big topic. It's 2024 and people want to lose weight. They're tired of the stubborn weight that's hard to get off, having those cravings late at night. Who wants to look good? I mean, everybody wants to look good. Being overweight can lead to lots of things. I mean, feeling depressed, feeling low energy. It could make your body pain worse. All of your arthritis is much worse when you're trying to exercise and you are overweight, including many other things like what it does to your body. That's why this is really important, right? 90% of 40% of Americans struggle with diabetes, especially type 2 diabetes. 90% of these patients struggle to maintain good weight despite many different treatment strategies. So this medication, the GLP-1 agonist, we want to know what it does, who is it good for, how does it work, right? Are there any side effects and what we should be monitoring? And then if there's any other questions at the end, we're open for a Q&A. The GLP-1 agonist, what that stands for is a glucagon-like peptide 1 agonist. And this medication is for type 2 diabetes that helps people lose weight, improves blood sugar, and reduces the risk of comorbidities associated with obesity, such as high cholesterol, stroke, and heart attack. So essentially, this medication is FDA approved for type 2 diabetes. And is not technically FDA approved for obesity, but it is used also for weight loss. More importantly, helping people reduce their risk and lower their risk for diabetes and having a heart attack, stroke, and even cholesterol. So it could be really fun. I see a lot of patients in my clinic feeling really good, doing a marathon that they haven't done in 20 years, super happy that their cholesterol just so happens to be lowering while on this medication for several months. And happy overall knowing that they have less chance of having a stroke and heart attack. So let's come back to how this medication works. Now, glucagon is a hormone that raises your blood sugar levels when they are low, as opposed to the way insulin lowers your blood sugar levels when they are high. So ozempic counteracts glucagon secretion. And that is good because it helps to maintain low or stable levels of blood sugar in your body and suppresses unnecessary spikes in your blood sugar. Why is that good? For many reasons other than losing weight, right? A lot of people feel that when their blood sugar levels are low, that they have dips in energy, right? Not only do you start sweating when you have hypoglycemia and you get anxious, so you could have anxiety and stress during that time, but also feeling a lack of energy. Sometimes people have such low energy when their glucose dips that they need a lot of caffeine or they feel like they're crashing and they need a nap in the middle of the day. So these are all really good things to put into perspective of why this is so helpful, and maintaining that constant glucose level and insulin and glucagon levels. So by signaling to the hypothalamus part of your brain that you're full when this counteracts glucagon secretion, this creates a feeling of satiety, a feeling that you're full, and so that you're not craving food, right? This is suppressing your appetite and even has been studied on that this medication can alter reward related behaviors and emotional eating. That's also another key point to why this medication is so successful, is that emotional eating aspect. A lot of people eat even when they're full, despite what their body's telling them. So another key point here. Also, when this medication signals to your brain that you're full and it creates this feeling of satiety, it is also slowing down gastric emptying, or the way that your stomach will pass food from your stomach into your intestines. This allows you to feel the prolonged fullness after a meal and decreases the your intestinal mobility as well. So everything kind of slows down here, so you can feel that feeling of fullness for much longer. That's how this works at suppressing your appetite. Now, how does it improve diabetes? So, with insulin, as I mentioned before, it's a hormone that turns food into energy. And when levels are too low, like in diabetes, your glucose remains high. With delayed gastric emptying and slower digestion, this means that there's less glucose released into your blood, and therefore it improves your own body's insulin production. Type 2 diabetes, your body, you have a lot of glucose released into your blood, and your body is constantly trying to meet that level with insulin releasing from your pancreas. And after years of struggling to meet that level of high glucose, eventually the pancreas gets tired and starts to slow down, and it can't meet that level for high glucose. And then you get type 2 diabetes, where the pancreas is slowing down, and therefore you need to take a medication like insulin to work that way into lowering your body's glucose. So the fact that it improves your own body's insulin production is, I think, really crucial here into understanding why this is not only helpful as a medication while you're taking it that will help you lose weight, but it's helping your body reset the same way that we talk about adrenal fatigue. When your body is stressed all the time, your adrenal glands get really tired and can't produce enough cortisol or energy to get your energy levels up, and it gets exhausted. So we need to do a reset, right? And when you're resetting one organ, you're resetting many of the other organs of your body, because that's what we do in holistic medicine, is looking at the greater picture of things. So when one of your hormones resets, a lot of your other hormones are able to reset in turn. What I want to talk about next is how do I take a GLP-1 agonist, right? There's many different forms of them, by the way. There's on the market, there's Ozempic, there's Mounjaro, right? Or semaglutide versus tirzepatide. Those are the other key words, and they're pretty similar with some minute differences. But in all, they are both injectable medications that is to be injected once a week as a subcutaneous injection, meaning that it is injected into the visceral fat of the abdomen rather than into a muscle. And the needle is pretty small. Most patients don't really feel the needle going in. I know some people are afraid of it because of pain, but the needle is pretty small. I find that a helpful tip that I give my patients, if they are sensitive to needles or have fear of needles, is to ice the area for a few minutes beforehand, or with a bag of peas, and then you really don't even feel anything. So it's pretty much just a once a week injection into the abdomen, and it's recommended to rotate injection sites from one side to the other so that you can reduce the risk of like bruising or skin sensitivity in that area. So what to expect when you're taking this medication? Expect a weekly injection, starting at the lowest dose possible, and that dose is different from patient to patient, and depending on whether you're taking semaglutide or tirzepatide. And the medication needs to be stored in the refrigerator. So when you travel, you also need to take it in a travel bag with ice, kind of like insulin. Weight loss can occur within the first few weeks of taking this medication, or it can take longer, once again, varying from one individual to another. Expect to be monitoring your blood here at the Akasha Center or with your medical provider. I like to monitor my patients' blood work every 1 to 3 months in the first 6 months to make sure that if there's anything that changes in their blood that I need to look at immediately, then I see those changes and we either adjust the dose and try to modify the symptoms. And I'll go into that a little bit more. Also, we can do in-person or telehealth patients to ensure the safety of this medication and to help adjust the dose according to what feels good for you and by looking at your weight as well. It does take a little longer for hemoglobin A1C, which is how the blood measure of diabetes, to adjust. Just to give a little more information on that, blood glucose it varies from every hour that you are eating food, right? And your insulin, it goes up and down throughout the day. Now, hemoglobin A1C is how we look at diabetes, and it's a measure of your blood glucose over the last 3 months. So patients on this medication, I usually don't see hemoglobin A1C decline immediately, like in the first 3 months, but then it slowly starts to dip as long as they're on the right dosage and continuing to exercise and eat healthy. Also, looking at hyperlipidemia or high cholesterol, those levels I continue to monitor every 3 to 6 months. They can also take a longer time to start seeing the difference, but generally I've seen that in within 6 months of taking this medication can tend to lower, especially LDL. But it does take time. So those are things to expect. Now, what else to talk about? Is this medication safe, right? Or who can take it and who can't take it? Pretty much the two diseases that are, if you and any of your family have ever had medullary thyroid carcinoma, which is a type of cancer of your thyroid, then you should not take this medication. It's not very common, but if you know that that's in your family, that's something that's a contraindication. Also, if you or anyone in your family has ever had multiple endocrine neoplasia type 2 or MEN2, that is also, this medication is also not right for you. Other things that your provider or me should know, if you're a candidate or not. If you have type 1 diabetes, that means that your pancreas is not really functioning well and not producing its own insulin. This medication has not been studied in clinical trials or FDA approved for that. So it's really only for type 2 diabetes and for people that don't have serious conditions related to the pancreas as well. So those are the two big things. What we can watch for if you have pre-existing kidney disease, diabetic retinopathy, those are other things that you may still be considered a candidate for, depending on the level. And that's what we're here to do blood work on and to do further testing to see if you are the right candidate for this. Another thing is that's recently been showed, if you're scheduled to have surgery or other procedures that use anesthesia or deep sedation, you should not use this medication before that as well, because it has been shown to increase food or fluids getting into the lungs because of the deep sedation, or if you're pregnant and breastfeeding. That being said, the most common side effects from this medication are nausea, constipation, diarrhea, stomach pain, and vomiting. So let's speak more about those, right? Because I see this the most out of all the things. So nausea. Nausea, while this medication can reduce your appetite, it's important not to skip meals. Nausea will take place as acid in the stomach builds up and there's no food to digest. So eating 3 meals a day is crucial to reducing nausea. And I always stress to my patients that when they start feeling symptoms of heartburn or nausea, to have a small snack. And that will usually help digestion and to help to slow the acid building up. If you struggle with nausea before taking this medication might make it much worse. So that's also something to take into consideration. However, touching base on that, not skipping meals, a big thing with taking this medication and having it being successful, as I mentioned before, is exercising and eating healthy. So eating healthy, meaning what to eat, is trying to eat less carbohydrates and having a lot more protein, healthy fats in your diet, and vegetables, right? The more protein you have, it will take longer to digest in your stomach than, let's say, a piece of white bread or rice. And that will help also reduce nausea. In regards to constipation or diarrhea, once again, if you have these symptoms already prior to starting this medication, then it may just worsen your symptoms. However, it's important to understand what is the cause of this, if you have constipation, for example, and try to work on holistic therapies with me, like if I'm a practitioner, to try to reduce these symptoms. So things that I recommend for my patients that have constipation are to eat a lot more fiber and drink water, 8 cups of water a day with fiber, like chia seeds, hemp seeds, certain beans, right? And lots of vegetables with water. That's a very important part, is with the water. As you know, if you take chia seeds and you don't add water, it's kind of like cement. So water, water, water. That can really help. Other things that are helpful are aloe vera juice, magnesium, etc. So there's a lot more things that we can talk about with my patients that usually helps. And vomiting, I have not actually seen any of my patients experience vomiting. I think, across the board of all the patients taking these medications, I don't have a lot of patients that are morbidly obese, that have had struggled with eating a lot of food at certain times. So that could be a gigantic change from eating large amounts of food several times throughout the day to eating less. And the gastric emptying could be a lot. So, I haven't seen that, but I also go really low, start at a low dose and go very, very slowly while monitoring my patients. So they're usually not experiencing such drastic symptoms. Pancreatitis, I haven't seen either, but it can happen. And that's why I monitor blood for these things once a month, so every 3 months, looking at your lipase and amylase as well as liver function tests, looking at your kidneys to make sure that you're able to handle the medication and the doses properly. Low blood glucose is another thing to monitor as a side effect, which could make you feel dizzy or jittery, especially if you have type 2 diabetes and you're taking medications that lower glucose like insulin or sulfonylureas. Dehydration can happen as well, which can cause or worsen kidney disease. So, and that's also because we want to make sure that you're having enough water, even if your appetite is suppressed as well. Gallbladder problems as well. Once again, these are all things to look at before starting these medications. But that's pretty much it. Once again, the most common side effects are nausea, constipation, diarrhea, stomach pain. Are there any long-term effects of taking or long-term risks of taking GLP-1 agonists? It's been on the market for 5 years and it's involved in 12 clinical studies. As of yet, there's no significant long-term risks of taking this medication, but studies continue to take place. In fact, it's quite the opposite. By lowering your risk of comorbidities associated with obesity, you lower, not just your risk of a heart attack or a stroke or diabetes, but you're lowering the inflammation of your entire body, lowering other diseases associated with obesity. So it has so much more benefit than we can even put into words, and it varies from individual to individual. So one thing to note here, one big question is, right, is will I regain weight if I stop using Ozempic? Ozempic is FDA approved only for type 2 diabetes to lower major cardiovascular events. It's not FDA approved for chronic weight management. However, weight loss is a side effect and is intended to use alongside exercise and healthy eating. And a lot of patients do go on this medication just for the weight loss. Although, even though that's not FDA approved, it's important to have healthy eating habits or develop them and have an exercise program while you're on this medication. So after, let's say you have met your weight goal being on this medication, and you've lowered your hemoglobin A1C, which is your diabetes risk factor, and you feel pretty happy being on this medication, and you're like, you know what, let's scale down. It's important to have meetings with a nutritionist, maybe a personal trainer if you can afford that, or have regular sessions of yoga and going to the gym with weight training in order to keep the weight off. Also looking holistically, balancing your hormones is another key thing to keeping weight off. And if you're eating the right amount of protein throughout the day with vegetables and water, your cravings are less, and that will help to sustain proper muscle gain along with weight loss, which will help you stay fit, have less cravings, feel stronger, right? A lot of times we focus on what we're losing rather than what we're gaining. And I always like to shift that perspective with my patients is like, what are you gaining out of this? Are you just losing weight, or are you gaining confidence, gaining strength, feeling really good about yourself? Maybe you have something that you want to do, like hiking up the top of a hill with your kids or your dog. That's something that you're gaining here, and gaining muscle is really key to that. So I want to just touch base on that for a moment. When you're thinking about food, let's say a starting goal for protein should be half of your body weight in grams. So let's say you are 160 pounds, half of your body weight would be 90 pounds, which means that you should aim to eat 30 grams of protein 3 times a day. What does that even mean, right? That's a good starting point. If you're lifting weights and really want to focus on gaining a lot of muscle, then that 50% can shift higher towards 70%, for example. But to start at that 50% goal and 30 grams of protein 3 times a day, what would your breakfast look like, for example? Your breakfast should be 3 eggs with cottage cheese and fruit, for example. That's a really hearty, protein-oriented breakfast that will lower satiety and cravings later in the day. Or having 2 pieces of chicken for dinner with quinoa and collard greens and onions, for example, or having a healthy fat with that, like avocado, will be a great meal for having 30 grams of protein. Other things that are good are 2 pounds of tempeh or tofu for vegetarians, with sweet potato, which is a healthy carb to have, and it is slow digesting to help keep your glycemic index low. With you can have vegan bacon, or there's so many options out there in terms of food, but those are some good examples. Also, yeah, so I think I mentioned healthy fats along with protein and vegetables. If you keep your focus on that, where you start your meal with a protein, you add vegetable, at least 2 servings per meal. That way you can have 4 to 5 servings every day of vegetables, right? That's key. And then the last thing on your plate should really be a carbohydrate. And if you eat the protein, then the vegetables, you're much likely going to eat a much smaller amount of carbohydrates at the end and feel really satisfied that you just needed a couple of bites. If you start your meal with, let's say, a bowl of pasta and say, I'll eat my vegetables and my chicken later, it's probably not going to happen. So that's a really big adjustment, is just knowing, okay, I'm going to start with eggs. Then I can add some vegetables to that, right? Like some spinach and do an omelet, spinach, quinoa in your omelet. You can top it with parsley and cilantro and avocado. And then at the end say, okay, now I'll have a little bit of fruit, or I'll have 1 slice of gluten-free toast in the end. And then that can be really satiating because you know that you ate enough protein, you're feeling good and full. So that's what I like to stress with my patients, is really, it takes time to just change habits of eating and to make those switches. It can take months, it can take years, but as long as you're starting now, you're starting somewhere. And those healthy shifts can really be satisfying because it can last your lifetime and feel really good and empowering. In terms of exercise, I always like to say it's important to walk every day. You know, the goal is to walk 10,000 steps a day. That's what our ancestors used to do. That's the ultimate goal. But let's say you are nowhere near that. You can start with 2,000 to 3,000 steps a day, which, you know, if you have an iPhone, it's super easy because you can get the health app. And when you open the health app, it can monitor your steps for you. Start your day walking, and that way you're more likely going to walk that way. Maybe take some Zoom calls if you're working from home while you're walking. And that's a good way to get those steps in. Also, cardiovascular exercise. You want to do 30 to 40 minutes of cardiovascular exercise at least 3 times a week. So that's a whole other thing that we can talk about. But you know, when doing cardiovascular exercise is really important because it gets your heart rate up at a percentage of your maximum heart rate for a certain amount of time. That will not only help you lose weight, but help to get oxygen and blood flow throughout your whole body, from your heart to your brain, to all the small vasculature in your body, from your fingers to your toes, your kidneys, all the things that can lose circulation when you have diabetes or when you get older, especially your brain. If you're worried about Alzheimer's, besides having a heart attack, cardiovascular exercise is important. It helps to flush oxygen and blood to all of these areas, right? Essentially, if you subtract your age from the number 220 and you times that by 50 or 70%, so 0.5 or 0.7, that will give you your maximum heart rate. So for cardiovascular exercise, you want to reach that maximum heart rate about 50 to 70% of the time that you're exercising. That is the ultimate goal. You can do more research or reach out to me for questions on that. That's certainly a good target goal. Also, lifting weights is another great way to exercise because and build muscle. Remember, we want to focus on getting strong, not just losing weight. So lifting weights at the gym, which if you're not familiar with it, it's always good to have a trainer. So you start low and slow and slowly increase what you can do so that you can do it safely without injuries. And one last question that I have here is, can I drink alcohol on Ozempic? A lot of my patients ask about that. And it's important, you know, to take this medication with me or your healthcare provider because, you know, alcohol can directly affect the health of your liver and your pancreas, which we want to monitor really carefully every 1 to 3 months with blood work to make sure that your organs are functioning well without problems. So I recommend my patients abstain from alcohol while on this medication because it can cause pancreatitis. However, if they are still drinking, I always advise that they cut down and continue to monitor their blood work as much as possible so that if there's any spikes or inflammation of the pancreas, we can catch it as soon as possible. But that's all I have for today. I think I covered the most commonly asked questions by my patients. And at this point, I'm ready to take any questions that I have from our viewers today.
One question was, my metabolism feels slower than ever. Are there things that work better for weight loss as you get older?
Yes. You mean outside of the GLP-1 agonist?
Yes.
Yeah. So, I mean, weight gain is something that we look at as a whole, right? It could be related to inflammation of your whole body, which, you know, for example, we're looking at years of stress, either from working a lot and having that kind of stress, or not sleeping well for many years. That could cause stress on the body, and it can alter your hormones, starting from years of adrenal fatigue to then your thyroid maybe producing less thyroid hormones, which in turn could, when your thyroid is lower, you have hypothyroidism, especially if it's not being caught by your provider. That can certainly make it difficult to lose weight and cause inflammation of your whole body. And as you get older, not only is it your thyroid that stops working as well, usually for a lot of patients, but then the rest of your hormones as well. Testosterone for men, progesterone, for estrogen for women. So, having a holistic provider and looking at the whole picture is super important to make sure that your hormones altogether are well maintained. And also, diet and exercise do affect your hormones, but also looking at sleep, making sure that you're getting good amount of sleep every night, having other ways to reduce stress. So, meditation, going for walks, all of these things as a whole can definitely affect overall inflammation and help with weight loss. But, it's tailored from individual to individual. If there's any specific things, we can go into that.
Thank you, Gina. We have questions from the chat. The first one is, I started last Friday on tirzepatide. I've had low-grade headaches. Is this a side effect?
That's a good question. I don't usually see headaches from my patients, but I think a big thing is making sure you're drinking enough water. 8 glasses of water a day with electrolytes, getting that proper hydration can usually help with headaches. Also, if you're drinking a lot of caffeine, that's super important. So I think I would recommend that. And then also making sure you get out for some fresh air. When you're starting a new medication, there's a lot of things going on in your body. Your body's processing things, so it's good to process that with a nice walk, get some fresh air, drink some water. That usually helps.
Thank you. And the dose was 2.5 mg. I think if there's a difference with your recommendation. The second one is from Tony. How many hours would you recommend between last evening meal to first morning meal?
That's a good question. I think it depends on what time you go to sleep at night. It's in general, it's good to eat your last meal before 4 hours of going to sleep and lying down. That is important here too, because the GLP-1 agonist can slow gastric emptying, and you want to make sure that your body is upright, at least in a seating position, for 4 hours, so that the food in your stomach can slowly leave your stomach and go into your intestines and get digested fully, as this process is much slower on this medication. So let's say you go to bed at 10 o'clock, your last meal should be like 5:30, and be upright and like moving around, maybe not running, but at least sitting upright. If you lay down after you eat, it can increase your risk of having nausea and acid reflux, as the food from your stomach or the acid from your stomach when you're laying down can come up your throat and cause those symptoms. In regards to weight loss, and speeding up your metabolism, intermittent fasting is a great thing to practice, whether you're on this medication or not. And intermittent fasting is essentially if you are having at least 16 hours to 18 or 24 hours between your last meal and the first meal you have the next day. So you can always start there and saying, okay, do I have 16 hours at least? And then drinking lots of water in between, as when you have less food in your stomach and just water, it gives your digestive tract a rest. And when your digestive tract is resting, the energy of your body can go to other places like your brain, so that you can think more clearly, and it can go to rebalancing your hormones, healing injuries. Your body can use that energy to heal. So intermittent fasting is always a good thing to start. But if you feel any symptoms on the medication, especially of like low blood sugar, like sweating, nervousness, shaking, those are symptoms of hypoglycemia, then you want to have something in between, at least some protein.
Another question is, how do I know if my hormones are out of balance and affecting my weight? What should I get tested for?
Yeah, so looking at hormones, it's good to, when we're looking at the adrenal glands, we look at cortisol. And looking at cortisol, the best way to measure that is to get really a 24-hour cortisol. That's a special test of Dutch that we do in our office to look how your cortisol goes up and down throughout the day. But the usual testing that we do is just the early morning testing. So if you wake up and within the first hour you get your blood work taken, we should see this incline of cortisol in the morning. That's the natural response. And if it doesn't go up really high, you're probably suffering from fatigue, feeling tired. So we know that you're having adrenal fatigue. Another thing is to look at your thyroid. As I mentioned before, the labs for that are your thyroid stimulating hormone, or TSH, your T3, T4. Those are the T3 are the main active hormone from your thyroid, and T4 can be turned into T3 to be used when necessary, and other labs associated with that, looking at selenium, looking at iodine, other things for the thyroid. For female and male hormone levels, you want to look at testosterone, progesterone, estradiol. Those are the main things. I like to look at precursors to those as well, including DHEA and pregnenolone. Those are the things that will also start to dip either before or during, like for men, when their testosterone is low, they usually have low pregnenolone beforehand. So I like to look at all of these things, which can certainly affect your energy, anxiety, your ability to build muscle, and do this properly.
Everyone is talking about Ozempic and semaglutide, but is it really safe long term? And what happens when you stop taking them?
Yeah, so as I mentioned before, there's like 12 clinical trials out there, and it's been studied for the last 5 years. There hasn't been any clinical trials that show any long-term risk of taking this medication, just the benefits. So it really is a great medication. As I mentioned before, it not only lowers your risk for cardiovascular disease such as stroke, heart attack, high cholesterol, and diabetes, but it also lowers overall inflammation of your body, right? We want to make sure that our body is feeling energized and lighter, and we're building muscle, etc. Was there a second part to that question?
Yes, what happened when they stop taking it?
Oh, so some patients will ask me, well, are they going to gain weight when they stop taking this medication? I think it all depends on where you're starting from, right? If, the majority of my patients are moderately obese to just being overweight, slightly overweight, and wanting to drop anywhere from, 20 to 40 pounds. But I think that if you are in the classification of morbid obesity and you drop 100 pounds and then you get off of the medication quickly, I think there is a higher chance that you will regain the weight, especially if you're not, really working with a nutritionist and a trainer, and having that self-discipline to eat really healthy and exercise, right? If you're in the class of most of my patients where you're just looking to drop 20 to 40 pounds, and I do that really slowly over many months, so it's not something drastic on the body. And as, let's say, you reach that goal weight and you want to maintain that, then we slowly decrease the dose, making sure your body's handling it well, making sure you're maintaining the exercise program, eating healthy. It usually doesn't happen so fast, but you can start regaining some weight once you're off of it. Some patients, from the last year that I've been prescribing it, choose to stay on at a very, very low dose for that reason, so that they can maintain their weight goal. And also, we're not only just looking at weight, we're looking at your hemoglobin A1C. So in 3 months, we're not going to see too much, but within 6 months, within 12 months, you start to see a drop in that number, right? I don't think I talked about it, but hemoglobin A1C is that diabetes risk factor that if you are 6.7 and above, that means that you have diabetes. If you are from 5.7 to 6.7, you're pre-diabetes. So really the goal is to get out of the diabetes above 6.7 and to be lower than that pre-diabetes risk, which is below 5.7. The most of my patients under 40 and 50 are in that 5.3 to 5.7 range. And the lower you get, which happens over time of being on this medication, the healthier it is for you, and the less risks of all of the comorbidities associated with them being overweight has for you. Also, it's been shown over time, if you're on this medication, to lower your cholesterol, which once again doesn't just happen overnight. So if you stay on this medication, once your weight is stabilized and you stay on and you continue the exercising, etc., over time your LDL starts to lower, as well as your hemoglobin A1C, and we start to see a lot of things working better in the body. I see my patients, as I do sports medicine and PRP injections. My patients with arthritis, their back has been hurting them, their hips have been hurting them for years after being on this medication and losing weight. They're feeling so good that they're out there on the bicycle, they're doing exercises like hiking and even running that they haven't been really able to do for years, so that they're feeling really good. So that's usually what I'm seeing.
Okay, we have another question. It says, I have PCOS and losing weight is so hard. What can I do differently to see results?
Yeah, PCOS is a very specific thing, right? That's polycystic ovarian syndrome that can affect all the hormones in your body and can certainly increase your risk of getting diabetes, right? It can affect that statistic for you. So, I mean, certainly this medication could be really helpful for you, whether you have diabetes yet or just if you have the PCOS and want to lower your risk of getting diabetes, certainly helpful. And especially if you have PCOS, you definitely want to have a healthcare provider such as myself or many of the providers in this office, like Dr. Nay, Dr. Boston, Dr. Dumble, that specifically manage female hormones. And they do it very, very well to optimize where your body's at and tailor a healthcare program just for you.
Right. We have another great question. It's how can I tell if my body is fat burning mode? Are there signs that my metabolism is working right?
Yeah, I mean, besides losing weight, that's why we look at blood work, right? Because we're looking at, blood glucose, fasting insulin levels, hemoglobin A1C, hormones in your body. The whole holistic perspective is important in getting the blood work done so that we can really see what's happening on the inside, not just a number on the scale.
Here's another one. I travel to work. I travel for work, so it's hard to stay consistent. What's the best way to keep making progress? So it says I travel a lot for work, so it's hard to stay consistent. What's the best way to keep making progress? So when life gets busy and they're traveling a lot.
Yeah, I think, there's a lot to that question. If you're traveling a lot and you're sitting down, meaning that you're not walking as much, I think a big thing is to add more movement to your lifestyle, right? And making sure that when you're not in the car and traveling, you're walking, you're stretching, right? Sitting down in general is, associated with weight gain. The more you move, the better it is going to be for you, especially if you can start taking calls, like work calls on the phone, or if you're at work, you can have a standing desk, or even some people have desks on their treadmill. That's amazing if you can do it. If you're like, I really can't do it, I work in an office, I'm sitting down. Other things that are helpful besides moving all the time is making sure that you're eating the right food. So meal prepping is super, super important. If you're really busy, having 1 or 2 days out of the week where you prepare your food in bulk, right? You cook a lot of chicken or a lot of fish, you steam your broccoli, you steam your carrots, you bake your asparagus, whatever it is, in bulk, and then you have a couple of meals prepared for yourself. So when you're busy, you're not just grabbing the first thing that is appealing to you when you're starving. That's a huge part about losing weight, is having those delicious, healthy meals that actually satisfy you and having a couple of things that you're actually really looking forward to eating. I think that is important. And then staying properly hydrated. I'm telling you, a lot of the times that you think you're hungry, are actually craving water. So if you start your cravings by chugging a glass of water, you may not even want that, thing of food or a cupcake that you see in the office in front of you if you just drink enough water.
So we have here, what's the best way to break through a weight loss plateau?
If you're on the medication, once people hit a plateau, then we need to go back to their dose. And it could be because their body just requires a higher dose. So slowly increasing the dose at that point would be safe. If you're not on the medication and you're reaching a plateau, weight loss plateaus usually occur as you get closer and closer, to your weight goal. So let's say you're 200 pounds and your weight goal is 150 pounds. The first 20 pounds usually sheds quickly. But as you get towards 170, 160, things really start to slow down, cravings increase, and it becomes harder. And that's your body's self-defense mechanism, right? Your body thinks that you're going into starvation mode. So then you get more hungry and you're looking for more food, right? That's how your body's like, I'm starving. I don't know what's going on, but let's slow down. If you're exercising, let's slow down. So in that last 10 to 15, 20 pounds that you're trying to reach your weight goal, then it's good to slow down where you're not doing things too drastically. I usually spread out that weight loss goal, that last 15, 20 pounds to like the last 3 to even 6 months, so that rather than losing 5 pounds a week, they're losing 1 pound every week or two. That really helps to create stability in how your blood glucose and insulin levels are going up and down. That really slows things down so that your body is like, oh, I can handle 1 pound every week or two. This isn't so much. While you're meditating and continuing to exercise and taking those long walks at the beginning or end of the day, that really helps to bring homeostasis.
Thank you so much. There's just one last one, and this one is, how important is gut health for weight loss? Should I be taking probiotics or doing anything specific for my digestion?
Yeah, good question. Probiotics are always helpful as a general thing to take. We always want to shoot for food, that contains probiotics, of course, like with yogurt, kimchi, sauerkraut, anything fermented. Pickles have really good bacteria that's helpful for the gut. If you have digestive problems currently, such as abdominal pain, constipation, diarrhea, bloating, gas, that's something that that I don't recommend is just going to be cured with probiotics. In fact, I work a lot with patients with digestive disorders. Initially I like to test for SIBO or gut dysbiosis with doing a breath test and a stool test, to send away to look to see if you have leaky gut, if you have what your good bacteria is like in your gut versus the overgrowth of bad bacteria. Maybe you went camping and drank water and have something like Giardia or parasites, worst case scenario, or some traveling diarrhea, or maybe you've been on several rounds of antibiotics for whatever reason, or have been eating a lot of processed foods, as a lot of my young teenagers and college students, and they get leaky gut from all the processed foods and pesticides in their foods that they're not even aware of. So having that in-depth testing, and if you have SIBO or leaky gut, it can take months to repair, not just with probiotics, but like we have our GI Align product that's really awesome that helps to heal leaky gut, and it's kind of like spackle for the intestinal wall. We have our protein powders that can lower inflammation here, such as our Infla Cleanse, together with greens powder is like a good start. Also digestive enzymes, that's usually where I start with patients that have digestive problems, is to take the GI Align powder to help with leaky gut, whether you've tested for it or not. Most of us have some kind of leaky gut from something we're doing. You just add some powder to your water. It tastes pretty good. Then also taking digestive enzymes or our digestive-zymes. You take 2 caps with your big meals, and that will give your body a break so that it can break down food for you, like the carbohydrates and vegetables and stuff like that, proteins, which can make digestion a lot easier and to help with symptoms. So that's kind of where I would start with that. I'm
Go
taking
ahead.
a question from my Instagram live.
Go ahead.
Any thoughts on eating vegetables as powder to mix into a drink? Yeah, so we have our like greens powder here, which I personally love. I think that getting micronutrients from greens powder or vegetables that are in a powder form are amazing for you, because that will give your body an energy boost from all of the antioxidants and polyphenols that it contains. Sometimes greens powder even has probiotics like ours does, and things in it like Jerusalem artichoke or inulin, which can help with digestion as a prebiotic. So yeah, drinking vegetables in powder form is really great. It can give your body a little boost in energy, and to help in the detoxification process as well, bringing more oxygen to your blood and all of your organs while it's working to, help you lose weight and to rebalance your hormones. One thing to note is drinking vegetables in a powder form like greens powder does not give you normally the amount of fiber that you want to have with your meals throughout the day. So eating vegetables is important, like like cooking your cabbage or boiling, right, or your broccoli or spinach, etc., gives your body the fiber to combine with protein to help you have normal and smooth bowel movements. The powder alone won't do that for you. So if you can imagine, like for example, cooked carrots are really usually easy to digest for anyone with digestive problems. Just boiling some carrots and mixing that or having that on the side with your chicken or your fish and some steamed spinach or asparagus is really nice, because it helps to push the protein out of your colon. So that's the only thing that I want to know, especially if you're on this medication and you can get constipation, etc. We need roughage. Other things that can substitute in somewhat for the vegetables are things like chia seeds mixed with tea, or chia seed pudding. That's an excellent way to cleanse the colon. Flax seeds as well are really good. You mix it with water. It's kind of like Metamucil. Those are all things that will help to clean out your colon and help with weight loss.
We do have one question in the chat, and it says, how do we get an appointment with you?
Yeah, so we have our staff available here by phone. You can call anytime and schedule an appointment. I'd love to hear from you. I want to just say that I offer 10-minute educational consults if you want some more information about the GLP-1 agonists, about how it may help you be a candidate or not. If you have questions about that and help to answer any other questions you may have, I'd love to see you here to help you with weight loss, to help you feel more energized, to help if you have any body pains or any digestive issues, and just to feel more revitalized as a whole. I also specialize in IV vitamin therapy, which always helps gain more energy, feeling fresher, feeling more alive. These are all the things that we're searching for, and I hope to see you here.
Thank you
Thank you
so
all
much,
for joining
everyone.
today. This was really fun.
Thank you. Have a good day, everyone.
Thank you.